And 15 organizations from local and international levels have signed off the terms of reference of our modus operandi. And the Troika chair for the group is Mkapa Foundation as the current chair, and the incoming chair is the Ifakara Health Institute. Furthermore, we have allocated ourselves the different organizations among the different technical working groups, which are led by the Ministry of Health, so as to enhance more coordination of our technical inputs and advice. Moreover, Madam Chair, our key recommendation to this end is to reflect and maintain the good history of Government of Tanzania in coordinating the sector with different partners, donors, and NSAs and faith-based organizations. This is an important area to be revamped and reviewed, particularly the technical working group, to become more active and functional. As NSA's health group, we are willing to provide further technical assistance, secretarial services, co-chairing the respective technical working groups to enhance their performance. Moreover, it is advised that we mainstream technology, if possible, to undertake the technical working group, now that the government entities have moved to Dodoma, so as to have a good representation of these groups and to be more cost-effective and efficient. Final but not least, the NSA Health Group finds it necessary for effective coordination between the government and the NSAs that we could have a more well-structured system of joint meetings which will engage equally on the same meeting, the Ministry of Health and PORALG, thus assist us to operate more effectively and efficiently. After these few remarks, I wish you all good deliberation during this very important technical meeting ahead of us. Asanteni sana.
Thank you very much, Helen, and I would like to ask Dr. Ogilo to present the private sector and FBOs, and the few remarks will be really few.
Permanent Secretary, Ministry of Health, Community Development, Gender, Elderly and Children. Permanent Secretary, Representative, Dr. Antuli Kapologwe, the Director of Health Services. Chief Medical Officer, United Nations agencies, representatives, development partners. Former Minister, Dr. Saif Rashid, former Permanent Secretaries, Chief Medical Officers, and other dignitaries, directors from government institutions, and representatives from other institutions of the government, representatives of the private health sector, NGOs, CSOs, invited guests, the media, ladies and gentlemen, protocol observed, good morning. May I thank you for giving us this opportunity to share with you our views on the health sector performance and during this reviewed period. And we're happy to be here also to share about our successes, our challenges, and issues from the private health sector. Madam Chair, I'm here to read a statement by the private health sector, which includes faith-based organizations, represented by CSSC and Quata and Afya, who are the self-sustaining. Allow me to thank the government of the United Republic of Tanzania, and in particular the Ministry of Health, Community Development, Gender, Elderly and Children, and the President's Office, Regional Administration, and local government for working with us in a coordinated manner and always willing to listen to our challenges and taking advice where needed. We have seen progress in public-private dialogue and openness in discussing matters of importance for the growth of the private health sector. We would also like to congratulate the government and other stakeholders for great achievement in implementation of the Health Sector Strategic Plan 4, such as construction of new health facilities, quality improvement, increased availability of medicines and medical supplies, just to mention a few. Despite the achievement made, we do understand that there is slow progress. Reorganization and identifying options for quick wins using evidence-based interventions as well as one of the fastest growing industries in the country. May I mention that last year, financial year alone, 2018-2019, 286 new healthcare facilities, private, were registered, a growth of more than 12% in a single year. More than 4,000 new jobs were created for the medical professions. This excludes hundreds of new ADOs, pharmacies, and standalone laboratories that were registered in the same time. The financial year 2019-2020, in the first quarter alone, more than 130 new applications have been registered for establishment of new healthcare facilities. This is a record high and deserves some clap. The private health sector is responding to the rapid population growth and the need for quality healthcare services by our citizens. Your ministry has shown tremendous support. The average time to get registration certificates has been reduced from an average of 2 years to less than a month after the board's approval. Many thanks to our Honorable Minister and Chief Medical Officer for being very supportive in ensuring the certificates are signed as soon as they land on their tables. Madam Chair, allow me to also congratulate Prime Minister's Office for coordinating the recently published blueprint. The blueprint is a well-thought process and roadmap to improving business environment in Tanzania. Health sector issues of concern have been addressed in the blueprint, namely, the need to reduce trust desk. This will be shortened. To minimize the number of private health sector regulatory authorities is another issue that the blueprint addresses. Private Hospital Advisory Board and Private Health Laboratory Board should be merged and should work under one roof. Pharmacy Council should not interfere with facility-based pharmacies, which can be regulated by the hospital board. Similarly, Radiology Board should also synchronize its activities with that of the Private Hospital Board. These are in the blueprint, and we are happy that we are moving towards the right direction. High charges by the National Environmental Management Council have also been reviewed downwards for the private health facilities, and this is encouraging for more investments. The aforementioned proposed changes have brought some hope to investors in healthcare, although there's still some work to be done in the implementation of the changes. It is the hope of the private health sector that the envisioned national health policy and health financing strategies will ensure that the private health sector is provided with a good growth environment and given its due place in the health sector development in Tanzania. The private health sector humbly requests that there should be no exclusion of health care providers from delivering services to the Tanzanians. We strongly recommend private health sector to be involved in all the reforms that aim at improving health sector delivery. For instance, the current improved CHIF program is mainly focusing on public health facilities. This exclusion is against the universal health coverage spirit. Any facility willing to offer services to insurance card holders should be allowed to do so, so long as they can agree and abide by the set terms and conditions. However, the minimum benefit package reimbursement should be carefully looked at so as to reflect the actual cost of health services. This will enable the private health sector players to actively participate in the program towards achieving universal health coverage. Despite the ongoing efforts to increase enrollment to health insurance schemes, the percentage of the population with health insurance is still low. We strongly recommend active involvement of all the players, all the sectors in increasing enrollment, such as engagement of faith leaders and other stakeholders in sensitization, as well as identifying best options for poor health financing. These need cooperation of all sectors. Permanent Secretary, in working towards achieving universal health coverage, the private health sector has supported regions and districts to translate public-private partnerships into action by entering into service-level agreements with the private health sector. PPP dialogue forums at council, regional level, which have proved to be effective, have also been supported. In 2018-2019, more than 500 service-level agreements have been entered into or renewed. The service-level agreements are on provision of public health goods, namely maternal, newborn, and child health, tuberculosis, HIV, malaria treatment services, etc. More should, however, be done in ensuring that the smaller health facilities, such as dispensaries and drug outlets, such as ADOs, should be involved in the active identification and screening of patients for tuberculosis as an area that need a lot to be done to meet the national and global targets. A success story is the current KUFIKIA project that is being implemented by CSSC in Iringa and Kagera, involving about 500 ADOs. Significant results have been achieved. More than 4,000 clients have been screened from March to July 2019, and 76 positive cases detected, out of which 4 cases were MDR patients. After CSSC and the Public-Private Health Forum, through the Ministry of Health, PPP coordination, have supported several regions in implementing service-level agreements in the same period, namely Iringa, Njombe, Tabora, Kagera, Morogoro, Geita, Singida, Pwani, Kilimanjaro, and Dar es Salaam. More support will be given for more regions in this financial year. However, various challenges are still being encountered. Among these challenges are unsatisfactory implementation of the agreement terms, and some officials not accepting the fact that people should work as partners. The decision by some local government authorities to construct facilities close to existing ones makes the private health sector hesitant to further investing in the health sector in some areas. The most recent example is in Morogoro, where the municipal council decided to construct a health center next to a private-owned health center that it has already service-level agreement with, just on the other side of the fence. Similarly, a hospital is being constructed within 6 kilometers from an FB hospital in the rural setting, leaving the larger part of the population in the same district without a referral facility. Something has to be done about this. It's not a good use of public funds allocation. In principle, we have no objection in public facilities being established, but there has to be transparency in the matter so that the private investor can take an informed decision. Honorable Permanent Secretary, the Ministry of Health plans to improve quality of care through star rating was good and very much appreciated. Other initiatives have also yielded much fruit. Safe Care and 5S joint supervisions have been found to be effective. We have seen this joint supervision work very well in the Quality improvement is of much importance in the delivery of healthcare services. Unfortunately, the private health sector has not been able to access support in this area in terms of financing to reach everyone in the sector. But private health facilities attend to more than 40% of the population. We appeal to the private health sector in this area of quality improvement. Madam Chair, other regulators have been seen to intrude into the private health sector in the recent years and have been destabilizing the private health sector. Regulators are charging. This in turn has been transferred to the patients and has made the healthcare services inaccessible to some citizens who need it most. Healthcare is a social investment. The most exorbitant charges are by OSHA, charging up to 2.5 million per facility. NEMC has also, in the past few months, started visiting facilities and requesting for environmental certification, which with very high charges. The facilities are established by an act of parliament that looks into the environment of the health facility. Presence of multiple regulators with multiple high fees is negatively affecting the sector. And the public facilities are established in the same way, and therefore we should consider this. We kindly request the Ministry of Health to communicate with the Ministry of Labor and Youth Empowerment and the President's Office, Environment, to discuss the issues of OSHA and NEMC in the health sector perspective. Madam Chair, health financing and human resources for health are key to quality healthcare development. We have seen the private health sector attempt to support the country in these areas. The construction of many healthcare colleges has contributed to the increase in number of healthcare graduates. Allow me to take this opportunity to thank your ministry for reviewing the entry requirement into mid-cadre training institutions. Thank you for hearing the cry of the private sector. Other initiatives taken to improve human resources for health is the recent establishment of the After Professional Development Institute. This is a unique institute that aims at improving the skill of human resources in Tanzania. Private health sector has established Afya Microfinance Company to provide affordable finance to improve the quality of care in the health sector. We believe that the government and the development partners will support such social investment that aim to improve quality of care. Madam Chair, we thank your ministry for developing guidelines for facilities that was launched last year. Unfortunately, the human resources for health that was required for facilities was much higher than that had been thought and agreed upon. Unfortunately, at the present, the regulations are already in use, and we kindly and humbly request your ministry to review these guidelines before it works towards negatively towards the private health sector development. Madam Chair, once again, we'd like to congratulate the government through the responsible ministries and other stakeholders for the work done and achievement made in implementing the Health Sector Strategic Plan 4. During the implementation period, several reforms took place, aiming at improving the health system. However, some of these reforms did not take into consideration the private health sector, and in turn some have had negative impact for the sector, threatening PPP spirit, but also sustainability of the private health service providers, particularly the FBOs in the rural areas. We strongly recommend Health Sector Strategic Plan 5 to create a favorable environment for strong stakeholders collaboration, especially in the rural areas and hard-to-reach areas. Madam Chair, the private health sector would like to assure you that it will continue to provide quality services, both curative and preventive. The private sector is still committed to achieving and improving public-private partnerships to ensure that the universal health coverage is achieved. We are ready to listen, proactively discuss, and cooperate to further our common goal. The recent enrollment and establishment of new facilities shows our commitment towards this. Thank you again for the existing cooperation. We look forward for further better cooperation in the future. Thank you very much.
Thank you very much, Dr. Ogilo, for that statement and for all the assurances you've given and the issues they've raised, which the government, I'm sure, is listening. We had longer statements than we anticipated, but it's no problem. We are going to recover them in this way. We'll add half an hour at the end of the day, and some of the presentation have agreed to cover half an hour. So we'll delay a bit for tea, hear the final, and then we'll come back. I would like now to invite Dr. Ntuli Kapologwe, on behalf of the PURAG, the DPS PURAG, to make a statement from the government.
Permanent Secretary, Minister of Health, Community Development, Gender and Children, Dr. Zainab Chaula, our Chief Medical Officer, Professor Bakari, WHO Country Representative, Dr. Tijest, Health Basket Fund Coordinator, Mr. Finn Paulsen, DPG Health Chair, Mr. Cho, CEO Afya, Dr. Samuel Ogilo, Chair of Non-State Actors, Dr. Helen, former leaders of health sector, RMOs, DMOs, medical officers in charges, representative, invited guests, ladies and gentlemen, good morning. My name is Ntuli Kapologwe. I'm the Director of Health, Social Affairs and Nutrition Services at the President's Office. On this occasion, I'm representing the Deputy Permanent Secretary responsible for health, Dr. Doris Gwajima, who couldn't join us today as she lost her father-in-law. PURAG is quite very excited to be in this meeting. This is quite very pertinent to us. Being a ministry responsible is implementation of policies and guidelines at the regional and district level, we feel that this meeting is quite very relevant to us. And being an overseer of the primary healthcare facilities, which are more than 6,000 across the country, and being the gateway to the healthcare system, we feel will benefit most from this meeting, and we shall be very happy to receive whatever resolutions to go and implement at the primary healthcare facilities. Madam Chair, the Minister of Health, together with PURAG and all the participants in this meeting, for the past 3.5 years, we've been able to implement a couple of reforms. And these reforms were around healthcare financing component, the introduction of direct health facility financing in more than 5,500 health facilities in the country, and also introduction or rollout of the improved community health fund. This is a massive achievement to be achieved within 3.5 years, and we believe it will contribute significantly in improving and transforming the health sector in the country. The second component of reform which we've been able to implement has been around service delivery, particularly in the improvement of the infrastructure, whereby as I'm speaking to you now, we have renovated and constructed around 486 health facilities in the country in the period of 3.5 years only. And on those 486 healthcare facilities, 320 are the health centers, 67 are the district hospitals. And when it comes to the supply chain management, we have been able to implement a public-private partnership where we have been able to introduce the prime vendor system. This is just to complement the medical stores department effort whenever there is erratic supply or stock out of essential medicines. On the component of the information system, we have been able to introduce the web-based plan rep, facilitate financial accounting and reporting system, and also the GOT homes. So these are some of the things which we've been able to implement in the 3.5 years. However, we have a couple of challenges ahead of us, which we'd like you, our esteemed stakeholders, to assist us to be able to implement. Some of the things are to digitize all the primary healthcare facilities. With the introduction of web-based plan rep, we have reached up to the district level. However, our wish is to go beyond the district level, is to go up to the level of the primary healthcare facilities, so as a community. The other thing we need to be supported on is on the human resource for health, and also the issue of medical equipment, and also the issue of accountability and governance. We have started with the Macaulay model, and our plan is now to go and roll it out to the entire country. What we have learned is that despite resources which you have been receiving from the government and also from the partners, but having no adequate accountability and governance, then you end up losing everything. Madam Chair, let me take this opportunity to thank you very much, the development partners, implementers at different levels, that's from the national to the community level, and everyone who in this room for actually contributing tremendous in transforming the health sector in this country. Having said so, let me take this opportunity once again to thank the Minister of Health for hosting this very important meeting. Asante sana kwa kunisikiliza.
Thank you very Dr. Antuli for that statement, short, clear, and affirmative. And we now would like to humbly request our PS, Zainab, to now officially open the meeting by giving her opening speech. Karibu Zainab.
Professor Mohamed Bakari Kambi, Chief Medical Officer from Ministry of Health, Community Development, Gender, Elderly and Children, Dr. Antuli Kaporogwe, Director for Health Services, President's Office, Regional Administration, Local Government, Dr. Tigesti Mengistu, WHO Country Representative, Dr. Cho Young. We are all doctors in this room. From DPG Troika Chair, Dr. Finn Posen, HBF Chair, Dr. Ellen Senkoro, Chairperson of non-sect actors, but also Director from Kappa Foundation, Dr. Samuel Ugilo from Afya, ex-Minister for Health, Dr. Saif Rashid, our dears retired permanent secretaries from Dr. Mbando, na wote hapo meza kuu. It has to be meza kuu as well. Retired chief medical officers, tuna mzee wetu mzee Upunda na dada yangu, lakini all invited partners, implementers, directors from Ministry of Health, BORA, and other ministries. Assalamu alaikum. Tumsifu Yesu Kristo. Good morning to everyone. Awali ya yote naomba tumshukuru Mwenyezi Mungu mwingi wa rehema na mkarimu, to his mercy to make us alive and well, to sit in this conference hall at peace. So we are all blessed. I thank you all. On behalf of the government and the Secretariat, to coordinate this important meeting, I would like to say you are most welcome. Karibuni sana. I would like to welcome you to the 20th Joint Annual Health Sector Tanzania Technical Review Meeting. It's my pleasure and a great honor to address this important forum that have brought together technical expertise and all valuable stakeholders in our joint efforts to improve the performance of the. My Chief Medical Officer, Professor Bakari, explained clearly this will be a 3-day meeting that will focus on discussing health sector performance. After receiving presentations that will highlight key findings of the midterm review of Health Sector Strategic Plan 4, 1 Plan 2, and Health Basket Fund functionality. During this meeting, we'll also identify which will be the strategic priorities which should be taken into consideration in the coming Health Sector Strategic Plan 5 and propose the policy recommendations for the year 2020-2021. This policy commitment will be presented to the coming policy meeting that will be held in second week of November 2019. I therefore appeal to all of you to have active participation during this meeting. Ladies and gentlemen, as we celebrate the 20 years of joint partnership through health sector-wide approach that is Health Swap, allow me to commend all stakeholders that have contributed and aligned their resources towards a common goal of reaching all households with essential quality services and ultimately improving health to all Tanzanians. However, we need to rethink on how health swap partnership can catalyze its efforts towards development and addressing health and slow progress in ending communicable disease, as well as the also challenged with insufficient coordination of stakeholders, which leads to inefficiency due to resources duplications, including time. There is a fragmentation and ultimately inequitable health outcomes. I would ask you to use this forum to request all of us to make use of the existing government financial system. This will lead to improved efficiency by reducing transactional costs and also increasing funding predictability. Ladies and gentlemen, you will agree with me the sector has successes to outweigh this success story. Therefore, my opening remarks will dwell on areas where we are having poor health outcomes and the challenges within the health system, impending access and the quality of health services. By doing so, I strongly believe this forum will come up with the ways to alleviate the existing challenges. As you all know, for more than a decade, Tanzania has made little progress in reducing maternal and neonatal death, despite government efforts in allocating more resources and efforts, but also in presence of many partners working on the area of maternal, neonatal, and adolescence. I used to recall this number now and then. Way back 1996, almost 23 years, maternal mortality rate was 578 per 100 live births. But 2016 health indicator survey showed clearly maternal mortality rate is still high. When you come to the next level of referral from dispensary to health center, the existing health center is only 12% of required, because 10 years plan of primary health care, it was stated clearly, we need each ward to have health center. Each ward composed with 7 to 10 villages. So we are missing, because it's only 12% of wards that are covered by health centers. But again, unfortunately, for many years back, theoretically you are saying we have a health center, fine. But we come to the functionality of these health services is an issue. So you will find we have invested in the infrastructure, and we came on shining that we have done a lot. Yes, it's a lot, but it's a lot to be done as well. We managed to improve this CEMOC, but also there's the issue of skilled personnel. There's the issue of medical equipment and supply. So when you measure in terms of performance, you will find there's a long way to go. But with this collaboration together, I'm sure we can reach somewhere so that everyone will share this success story. Ladies and gentlemen, available data show that most of the maternal deaths occurring in healthy facilities happen at a referral point, that is district and the regional. What does it mean? Something has to be done. We all know 80% of deliveries is spontaneously. And because this is spontaneously, and the majority deliver safely with their baby, and because the healthy facilities services are hampered, that's why they decided to deliver at home. But don't forget, 20% goes into complications which need probably surgical interventions. So where are these surgical interventions? That's why we invested at improving healthy facility. Though there are few in terms of 12%, but this clearly shows there is increased attendance to antenatal as well as institutional deliveries. Now is at 80% almost. So probably when we are reviewing this health indicator survey, we'll have some improvement, but we need to do more. So I urge all of you working in this area to undertake a thorough analysis to determine the main contributing factor, despite of improving, but still maternal death is high, and invest on evidence-based interventions instead of continue with business as usual. Business as usual, we all know, full of our plan is capacity buildings, training, retraining, and retraining. Unfortunately, the skilled personnel are few. So their receptors, because we are bombarding with series of materials, the receptors are fully saturated. As a result, they cannot absorb anything. So let us invest instead of having repeated capacity building and retraining. Just I'm requesting you to deploy in contract basis, because almost 50 to 60% of budget, government budget, goes to the salary, to the wage bill. I recall when I was at Porage, our budget Porage was 60 trillion.59. 4 trillion goes to the wage bill. But I have plenty of partners in this room. So I wish in your plan, please consider for employment in contract basis. Last 2 months in July, the government gave us the permission to employ 750 skilled personnel. 163 given to Ministry of Health, 550 to BORA to employ at the primary healthcare facilities. So the applicants from this 750 was around 16,000. It's difficult even to select. So we have a huge challenge. So let us think and rethink. How do we invest? And we all discuss about the issue of adolescents and young women. You will agree, this group has remained at a higher risk of maternal mortality and morbidity. 27% of women between age of 15 and 19 in the country have given birth or are pregnant with their first child. This makes Tanzania being among countries with high level of adolescent pregnancy. Also, this is one of the risk factors to premature death. So my plea to you is on scaling up investment in youth-friendly services at our health facilities as a means of addressing inequities when accessing sexual and reproductive services, and ultimately to address maternal issues. Ladies and gentlemen, another challenge the sector is facing is inadequate quality of healthcare services, as I said. Among other things, this is attributed by limited in number of health infrastructure, as I said earlier, particularly at a primary healthcare. So when you say we are doing a lot, yes, but there's still a lot to be done. The regional referral hospital lack adequate infrastructure and modern or modest equipment for specialized services and a shortage of specialized cadres. The existing healthcare workers have inadequate skills to meet the need of the changing disease pattern and health technologies. So let me request you again to support and invest in the policy option that will be endorsed by the Human Resource for Health high-level meeting that we expect to be held on 15th of November 2019 here at Dodoma. So I kindly request you to complement this effort in supporting human resource for health challenges. And again, we are discussing issue of improving availability of medical equipment and supplies. We manage to work with these prime vendors. There's a remarkable improvement, but still we need to have collaboration and harmonization, how to make this to be more feasible. Ladies and gentlemen, we have so many challenges, but this of health sector suffering for people to pay when they fall sick. It was explained clearly by Dr. Ellen Senkoro. Most of the time, we all know health insurance coverage is only 30. It's not even 30. I used to say it's only 7%, because 7% is the data from NHIF, and this is covered public employment. Because when you take community health insurance fund to add as if we are doing the best, we need here to do more. Because this community health fund, which is at 23%, it was meant to the villages, at the community dispensaries and the health center. But once the patient is referred to the national hospital, zonal hospital, even to the regional hospital, there's limitations. As a result, people, they cannot afford. Rise alarming of complainings. Everyone is complaining because they cannot afford. So the only way, of course, yes, the government is doing something to make sure that we are going to make a law that everyone has to have health insurance. So this is area also to be taken on board. And we are trying our level best to come with a homegrown solution. We are requesting the funds to make us to reach our intended destination. Another challenge, as I said earlier, is increasing burden and mortality from non-communicable diseases. Data is showing NCD accounts for more than 1/3 of all deaths, and the trend is on the rising hand. We have decided to champion National NCD Prevention and Control Program. I thank you all to make this happen, and we expect to launch in November this year. So I requesting all of you who are working on NCD to join hands and support this program to make it functional and to alleviate the disease burden. But also, as I said, malnutrition is an issue. On 2nd, 3rd, and 4th, we had a midterm review of multi-sectorial national nutritional action plan. We review our mileage and milestone. We have a lot to be done, and I argue let us use local made appropriate solution to alleviate this challenge of malnutrition. Is quite unacceptable. We are saying malnutrition 2016 it was 34.7. For 2 years we managed to reduce it from 34 to 31. So what type of nation are we building? So we have to facilitate the local made solution. As I mentioned earlier, one of the key outputs of this technical review meeting is to identify policy recommendations for the next fiscal year. That is just in next few months to come. Through joint effort with stakeholders, we have accomplished much of 2018-19 policy priorities. The achievement will be presented in the policy priorities implementation report at this meeting by reflecting on progress made in 2018-2019 policy recommendations. I believe we can develop priorities that are realistic and achievable within a span of 1 year. I argue and appeal to you to make policy recommendations that are implementable with the available human and financial resources. I would like to sincerely thank you all for all of the achievements that we have been attained in the sector, as without you and the collaborations, partnership we have made through Health Swap, this achievement would not be possible. Together we have made a solid foundation for our partnerships, whereby we all jointly work hard in concert to consolidate the gain achieved in the health sector. That's why I used to say, let us move together. Main is only to get it clear. What are the clear roadmap? Where to go? Which direction? At what concept? Who is doing what? And where? At what cost? So I enhance it transparently and sharing the gain. Otherwise, we'll keep on saying repeatedly with a little outcome. Ladies and gentlemen, At this juncture, let me take this opportunity to congratulate you and thank you all who travel all the way from different angles of the central part of Tanzania to join this effort, especially for supporting financial, technical, to make this happen, especially for those lucky enough. I listen them. I know the direction where we like it to happen, where we like it to go. Please accomplish by making it to be possible. So finally, accept my appreciation to all of you. With these brief remarks, on behalf of the Minister, Honorable Ume Mwalimu, who know that we are here, waiting to hear our recommendations to be approval to the next coming policy recommendation meeting whereby she is the chairperson. So now I have the honor to officially declare the 20th technical review meeting is opened. Thank you for your kind attention and God bless you all. Asanteni sana.
Thank you very much, Dr. Chaula, for those remarks. Before you opened the meeting, and you acknowledged the achievement that the sector has made, but also you have acknowledged the gaps that are still showing, and that's where we should focus our support and collaboration, especially maternal health, maternal mortality, youth services, quality, health financing, especially ensuring improved HF is doing what it's supposed to do, nutrition and the like. So thank you very much, Dr. Chaula. And now, once the meeting is opened, we have 3 things to do before we go for tea. One, we will hear from the Secretariat the objectives of the meeting which Dr. Chaula has just opened. Then, since the major events has been the midterm review of the Health Sector Strategic Plan 4, there will be an official launch of the report, both the analytical and the MTR at the high table, and then we'll do a group photo. We'll explain to you how we'll do the group photo. It is a challenge, but we'll manage. So I would like to invite Catherine to walk us through the meeting objectives of the 20th Joint Annual Health Sector Review, Technical Review meeting.
Okay. Once again, good morning, everyone. Yeah, dear Permanent Secretary and all the members of the high table, I would like to take you through the objectives of this meeting, but as you heard in the remarks from, particularly from the government side, we have already highlighted the objectives of this meeting, so my work has been made easily. I think you have all seen the theme for this 20th Joint Annual Health Sector Technical Review meeting will focus more on partnership, and we have developed a theme that underscores the importance of strong stakeholders collaboration and alignment, which is essential to delivery of quality health services for the healthier population and the national development. So when you see from this statement what we've done, we have highlighted what are the key principles which were mentioned in the objectives of the HSSP4, but also we link them to the expected outcomes, which in HSSP4 we have 2 on quality and equity, and ultimately we link them to the broader impact, which is mentioned in the Vision 2025, but also the Sustainable Development Goals. With the objectives, as I've said, they have been mentioned several times from the CMO, PS Health, so I will not really repeat. But I think it's important, all of us, to really have a common goal on what will be the output of this meeting. First and foremost, on day 3 of this meeting, we expect that we'll have an output on what are the focus priorities that will enable us to finish the implementation period of HSSP 4. But also we expect we will have the recommendations, priorities for the Health Sector Strategic Plan 5. But last but not least is the policy commitments for 2020, which will be presented in the 20th Joint Annual Health Sector Policy Meeting. So as you look on the 3 days timetable, the first day will really focus on receiving the findings of the HSSP 4, One Plan 2 and the Health Basket Fund, conclusions and recommendations which came from the midterm review. And on day 2, we'll proceed and start thinking what will be the priorities in the HSSP 5 based on the findings which would have been taken through today. And also, through the findings of this midterm review, we expect we are going to shape better the policy recommendations for the next financial year. So I would like to take you through with what were the objectives of the MTR. We wanted to assess the overall performance by tracking both quantitative and qualitative achievements and bottlenecks. So when we talk about quantitative, it's to review the performance of the indicators in the HSSP 4, One Plan 2 for reproductive, maternal, newborn, child and adolescent health, but also the Health Basket Fund. So that one will constitute the quantitative part. And when you go to the qualitative, we had taken together all the common themes which are coming out from the HSSP 4. And our aim was just to understand the achievements from the lessons learned, but also the bottlenecks. The second objective of the HSSP 4 MTR was to make recommendation for the final implementation period of HSSP 4. And the next one is to also make recommendation for the National Health Policy. As you're all aware, currently we are reviewing the 2007 National Health Policy, but also out of the recommended interventions, we will find a way of informing the health policy implementation strategy. And the last but not least objective, it is to make the recommendations for the HSSP 5 and the health policy. So that is the framework which we used when we were developing when we were doing the review. And our framework covered from the macro context. And here we took what are the broad issues which are coming from the national and the global socioeconomic factors, and also we looked in the political context in which the HSSP 4 takes place. We also studied the interaction between the mission of the HSSP 4 vision, but the inputs and processes, these were the health systems building blocks, and the outcomes, which were 5. And after that, we did a document review and also the field visits. And from there, we documented what were the good practices which have taken place from 2015 to date. And our analysis and synthesis was informed by both mixed method of qualitative and quantitative research. So in a broader picture, our review had 2 main aspects: the MTR analytical report, which focuses on the quantitative side, and the MTR main study that focuses on qualitative. And these 2 actually received information from the gender study, which we had added in as a cross-cutting kind of review, but also we had an equity study whereby we took the findings from the hard-to-reach areas of the country where we are seeing poor health outcomes. And also we had a triangulations with the One Plan 2 study. So this is the activities which were done from March to September this year. First, we started with a review in 9 thematic areas, and specific studies were conducted between March and July. And the review, as I alluded before, was informed by the Gender, Equity and Data and Analytical Report. We also conducted a field visit in 8 regions, whereby each of the national zones was represented by a region, and in each of those regions we visited 3 councils. And after that, we had an analytical workshop in the end of June, whereby the consultants and the technical support team met, and they reviewed the field visit reports, but also the desk reviews. And from there, they developed themes, the findings and the key themes of the review. And after that, we had 2 validation workshops in August and September. And this time around, we had an opportunity of presenting the draft of the findings during the RMO and DMO meeting. So, in this meeting, as we've said, we are going to have a discussion of findings of the MTR as we are preparing for the HSSP5. And that one will be facilitated by the presentation of the analytical report, general MTR report, and also the thematic areas presentations from the Health Basket Fund. And from there, we have designed our sessions whereby we are going to have feedback from the overall results of the review. We've tried to share the findings of this review, and I hope you've gone through them. And today we expect that we will have your feedback after those presentations. But also, as we've said, and that has been emphasized, in our discussion, actually we should brainstorm on how are we going to address priorities for the improvement of service delivery in the next HSSP5. As you've seen with the indicators, actually we have improved, but the targets for the HSSP4 1 Plan 2 will not, we foresee that those targets will not be met by next year. And also, we have to come out with a policy recommendation for the first year of HSSP5 implementation, which will be 2020 and 2021. And for the policy commitments, we are going to receive the updates of the 2018-2019 policy commitments through a gallery walk. This one will be tomorrow. And after the presentation from the gallery walk, we will also reflect what are the findings which came from the review, because the consultant and the technical support team had an opportunity of going through these policy recommendations since 2015. So we are also going to get to know what are the issues which came when we are tracking implementation of those policy commitments. But also, as you've seen from the recommendations of the HSSP4 main report, it has been recommended that we need to have a paradigm shift on how we are formulating this policy recommendation. So with those few remarks, I would like to thank you for your kind attention, and I would like us to proceed to the next session, which is the official launch of the HSSP4 midterm review. Thank you very much.
Thank you very much, Catherine, for the objectives. And now, we would like now to launch the HSSP4 MTR report, and it will be done as follows. A set of books will be handed to the PS, who will officially cut the ribbon and give 1 copy. There are 2 copies. One is the MTR main, one is the analytical. You'll hand over 1 to the PRAG, which are the implementers, and the rest on the high table. You have the books on your table. You will stand up and raise the copies up. That will be the first photo. But the theme of this year is strong collaboration. So we have to show collaboration in pictures, which is you'll hold hands across the table, and the next picture will be taken. Those are our MTR will be launched. So the MPS, you have been handed. Mkasi upo, nani Catherine? Okay. So, so I request I to stand, and the tables of water, bottles of water can be hidden, and then we request Zainab to officially launch our MTR report by cutting the ribbon. Yoyote, one of them. So, no, don't raise it until he has handed over to the BORA. The government leads this, the Minister of Health's policy, the BORA oversees implementation. So with the government in the leadership, we now, you can hand over one of them. Moja, yoyote, mpe moja. Analytical maybe is better. Now, the high table, please raise one of the copies you have, whichever you prefer. I'll see the preferences. Now, please, you can put down the copies, hold your hands together, and then raise up. Hold them, raise up. That is strong coordination and collaboration and alignment. Thank you very much. You know, launching a building is, you cut a ribbon, you see the building, but launching brick is a bit of a challenge. So now I would like guidance from the Secretariat on the photo op, because we are so many, so maybe, how are we doing? Catherine? The photo. Yeah? Wanakuja kwa magrupu. Wanze wa yeah. Okay. Alafu wanakuja DP. Okay. Okay, so okay. So let's start with the think tank, and the think tank involves the former leaders of the sector who are representing all of us retired and not tired leaders. Please pass behind the high table. So, Madam PS, if possible, as they are coming, hand them over one copy. Catherine, can we have copies for the retired leaders? Okay.
Happy to see you.
I would need NGUZO mnaanza kunipa tupige picha kwa
Please, Finn, you can sit. It's okay. Dr. Ogilo, please, you'll greet them later. Okay. Thank you. Thank you very much. So now I would like to invite all development partners to come to the DPGH, all development partners, including Petra. I think you are just wondering, you are part of it. You are not sure. So let's see, some can stand behind, some can stand in front. That's fine if we are many. Some stand behind the leaders, some can stand in front until we are all, including you. Thomas. Thomas.
Jamani, sogeni tutoshe.
Move over to the other side, yes. You are crowding the exit. Yeah? Okay. Okay. When you finish taking the photo, go to the tea already. You can start having your tea. Yeah. Thank you. Thank you. Minister of Health, the government people, Wizara ya Afya. Minister of Health, please join. Sijui mwende na watamisemi kabisa. Wangeruhusu na hapa chini nafikiri ingekuwa vizuri. Wengine wangesema. Okay, wataenea. Ministry of Health includes its institutions. Institutions are part of the Ministry of Health, unless you are moving to Porag. Ministry of Health and its institutions. That's Levina. Ministry of Health and its institutions. If you can't jump, you go the other side. Thank you. Huku hamna ngazi. Ya ndio nilikuwa naambia wange. So you can come in front, njoo hapa, panda hapa. Njoo kanyage hapa upande hapa. Kanyage hapa. Sogea mbele. Okay. Thank you. Here without the MTR report, so I would like the MTR team and that both the main and the analytical up there. The secretariat, get ready. You can go to tea now. Let's coffee. Yes, I will do. Okay. We are old men also always conspire. Okay. 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 The secretariat come first. Secretariat. Health Sector Resource Secretariat. Very quick. Please note that Afya Online TV is online, so you can go and look at see these events as they are happening. Afya Online is online. The secretariat, then the okay. Kwa hiyo wafuate nani? Wafuate nani? NGOs, private? Yeah. NGOs and private, get ready. We start with NGOs and then private. Get ready, come closer. NGOs. NGOs, ampo. NGOs. Others, when you have taken your photo, go and have tea. NGOs are few, so private you can join. Mko wengi. Sasa mbona wainuki? NGO, I'm told you are the biggest. NGO karibu. Karibuni. NGO group. Yeah, that way. Kapande. Sekela, NGO. PRAG, get ready. Nilisahau serikali sijamaliza. PRAG. PRAG, yes, we are coming after this. Okay, NGO stand still. Good. NGO are all young people. Where are the old ones? Okay. PRAG, please. Samani nilisahau. Nilikuwa nimesema lakini wakasema ana institutions. Nitaka serikali pamoja. PRAG, private sector, move forward before we go to the rest of the PRAG in the regions. Dr. Ugilo, bring your private sector people in front. Au mmeshaingia hapo? Mmeshaingia? Okay, okay. Mliingia pale? Nilisema wajipange. Private sector. Mmeingia kwenye njio? Okay, private sector and faith-based organizations up. And faith-based and private. Ndio nakuja nitaka waongozane na PRAG lakini okay. RM was officers in charge of RRH to be ready. People from other ministries. Other ministries, you have? Okay. Nitakiwa niwaite baada ya kiorani. Quick, okay. We have also in the meeting other ministries other than Ministry of Health and Porag. Please come up. Other ministries. Okay. Okay. Other ministries including the Prime Minister's office, get ready. The Prime Minister's office and all other ministries for intersectoral collaboration, health in all policies. Prime Minister's office and other ministries, health in all policies. Medical officer in charge of RRH, medical officers in charge, please come forward. Hawapo? Please. Oh, okay. Oh, you're there. DMOs, please come forward. Umekuja kwa baba.
Baba mfupi baba. Baba mfupi. Baba inabidi uongeze kiatu.
All other remaining groups, please come forward. Wote mliobakia naomba mje mpige picha. No, ameisha.